Hi, this is Dr. Seymour Kern, coming back to the book Low Noise Thinking. Um, and this is what I wrote in the year 2009. There have been some changes, but I'll do some commentaries as we go. So, Chapter 14, the Psychodynamics of the Schizophrenic Mindset. Well, that's a mouthful. So, one of the most heart-rending mental problems for a family to experience occurs when their dearly beloved child gradually starts to display the signs and symptoms of schizophrenia. This is a psychosis or a structural hardware problem as opposed to a neurosis, which is a programming or software problem. So, this is a psychosis of a structural hardware problem. In other words, like a damaged area, which is causing a structural response due to the structure. In other words, so it's not a neurosis. A neurosis is a software problem, not a hardware problem. So, a description of schizophrenia can be found in Appendix 2 of the book, which we'll go into later. How can low noise thinking, i.e., LNT, possibly help those afflicted with schizophrenia and or related mental disorders? According to LNT theory, if one can define the structure, then one can determine its function. Let's take an LNT approach to analyzing in the simplest way the structure and function of schizophrenia. For the purposes of this chapter, we will refer to this illness as S for convenience. With schizophrenia, there is an area of micro damage in the brain at a critical nervous interchange that interacts with a combination of visual and or auditory stimuli. The damage area can be rather large or is in most cases microscopic, so microscopic that it's almost virtually invisible for all intents and purposes. The damage area can be large, as in most cases microscopic. The more strategic the location of the damage zone in the brain, the more devastating the symptoms. As discussed earlier, almost all biological tissue, when traumatized, will emit an electrical or chemical damage signal that could be sensed in terms of pain, light, image, smell, sound, touch, etc., depending on the strategic location of the body. So, once a brain cell dies, it is replaced with scar tissue that does not transmit any electrical pulses. Its structure and function are not restored. The interface between the damage area and the good tissue is where the damage signal is believed to originate. We can either reduce the intensity of the damage signal by perhaps taking certain drugs, or we can find ways to wall it off mechanically. There are a number of drugs that seem to be helpful, but they have devastating side effects that can be problematic. It can also result in non-compliance, whereby the patient does not take the medication as instructed. This can be very frustrating to all parties concerned, as you may appreciate. According to LNT theory, given the infinite storage capacity of the brain, even if some of it is removed by disease or injury, there could be sufficient residual structure and function to predict and or treat schizophrenia in the future. We must understand that there is a very delicate balance between the unlimited storage capacity of the brain and the ambient noise level that moderates input and output or retrieval. For example, electromagnetic resonance, analogous to recall. With schizophrenia, we have a conflict of interest of a kind. We need noise to block the damaged signal that is headed for the sound and visual hallucinatory centers of the brain. At the same time, we require the reduction of noise to be able to retrieve information. Thus, there is a conflict, too much or too little noise. Which way do we turn? Now that LNT allows us to look at the issues in a simpler way, the solution may not be too far away. We could perhaps lower the noise to allow access to useful information and selectively wall off the damaged signal using targeted specific drug treatment or psychotherapy. We can discuss just a few of the wide range of possible approaches to optimize the quality of life in the chapters to follow. Many psychotic illnesses share the damaged area concept at a critical interchange in the brain to explain a specific behavior consistent with the diagnosis. Thus, we should be able to effectively diagnose and treat them using LNT noise theory by elevating or lowering noise specific for a mental condition as best approximation to the ideal. I feel that LNT now provides a far more simplified abstract means for understanding both the structure and the function of the finite world as well as the infinite realm of Neverland. Simply stated, LNT provides an extremely powerful visual and psychodynamic tool to bridge our finite daily experiences with our infinite minds. This is, in essence, the basic theme of low noise thinking. Thank you.